Garlic has a very long history of use, with Sanskrit records documenting its use around 5,000 years ago. In more recent times, Louis Pasteur was one of the first scientists to confirm it has antimicrobial activity. It has a range of effects, particularly on cardiovascular health and immunity. Whilst fresh garlic can be used medicinally, other preparations are available, such as tablets from freeze-dried garlic powder, garlic oil, and aged garlic extracts. These may be standardised for various active constituents, including organosulfur compounds and metabolites such as allicin and S-allylcysteine. Garlic has a wide range of actions that you can see on the screen that can affect cardiovascular and immune function, among other things. According to systematic reviews, garlic lowers both systolic and diastolic blood pressure in people with hypertension and can, if required, be used as an adjunct to antihypertensive medications. Reductions were in the region of 5 to 6.7 millimetres of mercury in systolic blood pressure and 2.5 to 4.8 millimetres of mercury in diastolic blood pressure. In hypercholesterolemia, garlic may reduce total and LDL cholesterol in individuals with elevated lipids when used for longer than 2 months. Reductions in LDL cholesterol have been around 10%. There have, however, been mixed results in clinical trials, and these are likely due to differences in preparation types and dosage regimens. But in general, the longer the intervention, the more significant the outcome. Hence, benefits are likely only after a couple of months. All in all, for reducing cardiovascular risk, garlic may lower blood pressure and LDL cholesterol, prevent LDL oxidation, reduce platelet aggregation and adhesion, and reduce progression of atherosclerosis. In experimental studies, garlic enhances immune system function by modulating cytokine secretion, immunoglobulin production, phagocytosis and macrophage activation. Clinical trials for infections are, however, scarce, but some research suggests garlic may aid in preventing the common cold, though more studies are needed to confirm this. Garlic is usually well tolerated, but adverse effects can include mild gastrointestinal effects. Avoid high doses in patients with bleeding disorders and also 2 weeks prior to scheduled surgery. And in pregnancy, garlic is fine, just don't exceed normal dietary intake as a general caution. It's unlikely to increase bleeding risk if taken alongside anticoagulant and antiplatelet drugs, unless high doses are taken. In summary, garlic has a long history of use as both a food and a medicine to decrease cardiovascular risk and support immunity. It's a great regular addition to the diet to derive long-term benefits for cardiovascular health.